For decades, anytime we talk about the NHS, it's always about the same things, right? Money, staffing, waiting lists. But what if the real problem, the one that's actually making everything else worse, is something we almost never discuss? Well, today, we're going to dive into a blueprint that argues the NHS's real sickness is its addiction to constant change. And this quote, it absolutely nails the core idea. It suggests that for 75 years, instead of making steady, meaningful improvements, the NHS has been trapped in this frantic, endless cycle of reinventing itself. So let's unpack what that actually looks like. You see, the first thing to get your head around is that this isn't about one or two bad reforms. No, this is about a relentless, destructive cycle of reorganization. The very structure of the NHS is basically in a state of permanent revolution, and that has a huge and often hidden cost. Okay, just look at this timeline for a second. It's almost comical. We started with 14 big regional authorities. Then, nope, we switched to 95 smaller ones. Then, you know what? Let's try 303 primary care groups. Actually, scratch that. Let's go with 152 primary care trusts. Wait, no, the answer is 211 clinical commissioning groups. And now, we're at 42 integrated care systems. It's this dizzying, exhausting dance of tearing things down and building them up again. And again, and again. And this slide really puts it into perspective. It shows just how bizarre our approach in England is. While we've been caught in this whirlwind, other successful health systems have been, well, stable. France has its 17 regions. Denmark has 5. Sweden has 21. They make careful, purposeful changes. We just keep hitting the reset button. So what's the real damage from all this chaos? It's not just confusion or losing all that built-up experience. There is a massive, eye-watering financial cost. So let's do what you always do in these situations. Let's follow the money. The analysis estimates that all this constant restructuring has cost somewhere between 50 and 70 billion pounds. I mean, that is a staggering figure. So the obvious question is, where on earth did all that money go? If it didn't go to patients or doctors or nurses, who got it? And here's your answer. The money created an entire industry that actually profits from this instability. You've got the big management consultancies like McKinsey and KPMG brought in to plan the next big shakeup. You've got accountancy and legal firms to sort out the new contracts and finances, IT contractors to build shiny new systems, often to replace the ones they built just a few years before. And then you have interim managers earning up to £1,600 a day, brought in to manage the very chaos the reforms created in the first place. And this is the point that really hits home. It's not that the NHS was starved of cash for all those decades. It's that huge sums of money were systematically shoveled into the furnace of this engine of reform, feeding an industry that thrives on churn, not on patient care. Okay, so that's the diagnosis. It's a pretty bleak one. But what's the cure? Let's switch gears and look at the actual solution being proposed here. A plan to deliberately engineer stability into the NHS for the next 30 years. The whole plan really rests on 4 big ideas. First, and most importantly, a stable structure. Second, we need to move towards genuinely integrated care, not this weird internal market system. Third, we've got to truly modernize primary care. And fourth, the one we're about to dig into, is a proper, serious injection of capital investment to fix decades of neglect. So pillar number 1 is simple, but it's also pretty radical. Create about 30 to 35 regional care authorities, and then, and this is the key part, leave them alone for a generation. The idea is to make them politically insulated, give them control over their budgets, and let them get on with the job of joining up hospitals, GPs, and social care. Basically, do what works in places like France and Denmark. The second pillar is all about ending this failed 30-year experiment with internal markets. You know, that whole idea that hospitals and clinics should compete with each other. Well, this blueprint says that has to go. Instead, we go back to common sense planning. You figure out what a local population actually needs, and you fund them directly to provide it. Okay, so stability is one thing, but you can't build a 21st century health service on crumbling 20th century foundations. So let's talk about the final, crucial piece of this puzzle, the one-off investment needed to finally catch up. Now, what I love about this is that it's not just a big, scary number. It's broken down. It's targeted. We're talking 10 to 12 billion to fix the leaking roofs and broken equipment in hospitals, 5 to 7 billion to finally get the digital systems talking to each other, billions more for expanding GP services, for mental health, and, this is so important, for prevention. to stop people getting sick in the first place. So what's the grand total? A one-time investment of 22 to 27 billion pounds spread out over 5 years. It's a huge number, no doubt, but let's put it in context. Let's be really clear, this isn't some luxury wish list. The argument here is that this is the bare minimum you need to spend just to stop the rot after decades of decline. It's the price tag for finally getting the basics right and building a platform for the future. And here it is, the real gut punch. Remember that 50 to 70 billion pounds that was burned by the engine of reform? Well, if the NHS had simply been left alone to do its job, it could have paid for this entire modernization program twice, with change to spare. The money was there. It was just spent on the wrong things. But you can't just fix the NHS in a vacuum, right? To get that kind of stability, you have to look at the root cause. Why does this churn keep happening over and over again? Well, the final piece of this puzzle argues the problem isn't just in the NHS, it's in our entire political system. Think about it. With our first-past-the-post system, a new government can come in with less than half the country's vote and have the power to completely rewrite the rulebook for the NHS. It actually encourages each new minister to make their mark by launching another grand reform. Compare that to countries with proportional systems like Denmark or Sweden. They have to build consensus to make big changes, which naturally leads to more stable, long-term health policy. So what this all boils down to is a really powerful and kind of challenging idea. You might not be able to build a truly stable national health service on top of an unstable political foundation. The two are fundamentally linked. Which brings us to this final, really great way of thinking about it. The NHS doesn't need another quick renovation, another coat of paint from the latest minister with a shiny new plan. It needs deep, serious, long-term engineering to make it strong enough for the next century. So let's just pull it all together. What is the vision here? It's one single, long-lasting structure. It's integrated care planned around people, not profit. It's that serious one-off investment to modernize our buildings and tech. It's a real focus on prevention. And crucially, it's all of it protected by some kind of cross-party agreement safe from the whims of short-term politics. And that just leaves us with one final, kind of mind-bending thought. In a system that has known nothing but constant, frantic change for 3/4 of a century, maybe the most radical, the most revolutionary idea we could possibly try is to just stop and build something that's meant to last.